blow again. Good day, my name is Dr. Rapiti, and you can see a patient of mine using a peak flow meter to assess her asthma. If you look at her in your mind, I'm sure every one of you would think that she's absolutely comfortable and there's nothing wrong with her and she's fine. And what this peak flow tells me is the level of oxygen or airway function. Now, if we had to ask Natasha how she feels, Chantal how she feels, she will tell you. Chantal, tell me how you're feeling at the moment. To the world, you look very comfortable. What do you feel like?
The breathing is very slow and it's very uncomfortable.
Right.
And I can't walk very fast and having breathing problems at night or in the morning.
Right. Okay, I'm going to take the focus off from Chantal now and show you some of my pictures and watch as I talk. Chantal's peak flow was 50. Now you can imagine somebody that looks like that, you might think she's perfect. No, she's got severe asthma. People make this mistake constantly, as if their oxygen levels should be, or they should have wheezing and so on like that. But Chantal's going to point out to me, and then I'm going to speak. Now, what actually happens is that they look comfortable, and what they're told all the time is you must only use your pump when you get severe wheezing and you're gasping for breath and you can't walk. No, that is not true. In fact, the most common symptom of asthma is a cough, and you could have a very tight chest and look perfectly normal. And doctors can check with the stethoscope and they'll hear a clear airway and say there's nothing wrong with you. But yet, if you use something like this, I mentioned before, her peak flow was 50 when she came in. We put her on oxygen, it came up to 200. Normally, this type, a person her height should be blowing up to 400. So even though Natasha, Chantal is on, my patient's on pumps, she's still not being properly controlled. And that is because when you have weather changes, like we have the extreme cold weather, that acts as a trigger factor. Your pumps are not sufficient. It's not that they're not good enough or they're not working. You've got to work in a stepwise process. We've got to add medications like prednisone. I also bring this point in the time of COVID. Many people with asthma, when they cough, the first thing they think about is having COVID. Not everybody who coughs has COVID. If you're asthmatic or you have asthma, during change of weather, you are going to cough. And the difference between a cough from asthma and a cough from, say, COVID is that with COVID, you'd cough the whole day. But with asthmatics, there's a particular time of night that they cough. It's more at night. If you are coughing more at night and not so much during the day, you can be rest assured that you're not having COVID, but just your asthma playing up. And don't try and use cough medicines, because that's not going to help your cough. You need to use a good pump, and I'll show you the pump I'm going to mention. It's something like this. It's a Symbicort pump, but there are many like that, and this is how you should use it. You turn it this way, open it out, and then you click it this way. You hear the click, and you can breathe out. Breathe it in, keep it in for a while, and breathe it out. And you do this twice a day or even thrice a day. It works very well. You don't use this other pump, which is called the Asthmatics, because that pump is not a preventer. It doesn't solve the problem. You need a preventer. This is a dual acting pump. And during the winter months, use it regularly, because this particular pump will prevent complications. If you had COVID, it'll prevent you from being hospitalized. It's a very safe pump. Pumps don't weaken your heart. And don't get this idea about saying, I'll use it when I feel the need to. Because when you do, your chest is so tight, no amount of this pump will be enough, and you might end up being hospitalized. What you should do is, if you have peak flows of 50 and 200, then you are a chronic asthmatic, use your pump regularly. The idea of treating asthma properly is to make you as normal as anybody else. Now remember, the pump is the thing that you're going to use, a steroid that's going to help you to stop the coughing. And if you do have hay fever, we'll introduce you to another spray, and that is this. If you have rhinitis, you must use your nasal spray one across this way and breathe it in, and that will stop the mucus from forming. Don't use these drying agents, they're no good. You've got to use something that stops the production of mucus, because 50% of the world's people breathe with their mouth, and that is not, that cold air that goes in acts as a trigger and makes their chest tight. But yet if they use a nasal spray, particularly at night, their noses up, they breathe through the nose, because remember the nasal passage is a big surface area. It warms the air. So if your temperature of the air is -2, by the time it gets into the lungs, through the air, through the nose, it gets up to 35, 36 degrees. So when you're breathing the cold air through your mouth, you are definitely going to get spasms in your chest. So don't get paranoid if you've got asthma and you're coughing and you think you've got COVID. I've had many people coming to me saying, oh doctor, I've got COVID, I think I'm going to die. Another clue for doctors watching this is that if you have somebody say they can't breathe, the chest is tight, if the oxygen levels are fine, 97%, but the peak flows are low, you can be rest assured you're not dealing with COVID, but you're dealing with asthma. So I hope this little video helps you to understand it. Don't be frightened if you've got asthma. Treat your asthma, and if you've had COVID once, it's unlikely you'll get it again. What you should be doing is that treat your asthma regularly. The asthma pumps do not weaken your heart. They're the safest. Use it regularly. It's better to live with an open chest than to try and work with a tight chest and save yourself from not using the pump. That's a bit old-fashioned. It's granny's tales. The pump doesn't kill you. On the contrary, untreated asthma kills you. So don't be shy. The dose in the asthma pump is minimal. I hope you enjoyed this video and have a good day. Thank you.